Okay, so the cheek teeth are the teeth that are back in the mouth behind those big cheeks. Those are going to be your premolars and your molars. So when dealing with issues in that location of the mouth, we have malocclusions, just like we had with incisors. We have infections, just like we had with incisors. And then trauma is another thing that we'll occasionally see. So again, the definition of a cheek tooth malocclusion, those teeth are just not lining up appropriately. And so if those teeth are not lining up appropriately, well then what happens? As they inappropriately line up, when they do their grinding and chewing of their food, things are not going to grind down as well as they should. So you may have the development of things called points or spurs. You can have what's called a wave mouth, where some molars are tall and some are short and then some are tall, so it's kind of like a back and forth sort of thing. Or you can just have all of them sort of be really tall and abnormal. So we're going to show you a few pictures of the molars back there and what we're actually looking at when we look in their mouths. So this is a rabbit who is also on a dental rack. This rabbit's under anesthesia. And what you're looking at is you have your lower incisors down here. This is the tongue of the rabbit. Up here, that's the upper cheek teeth. We have the lower cheek teeth on the right side, lower cheek teeth on the left side. You can see this tooth right here, how big and tall that is compared to all the others. This one's sort of an okay height. These are kind of an okay height, but this one is just really tall and has that big spur. If you had something like that in your mouth, you could imagine how when you're kind of chewing on your food and if your tongue scrapes up against that, it'd probably be a little bit sore. You probably wouldn't want to be eating as much, and then your rabbit could start showing signs. So you can see how that would be pretty sore to have in your mouth. The other ones on the bottom here are also not totally normal in that those are a little bit higher spikes than I like to see right on the edges. But that one's really, really, really obvious that it's quite large. This is more a picture of what is called the wave mouth. We're back on a dental rack again. This rabbit's under anesthesia. We're using a little tool to kind of push the tongue off to the side so you can kind of see what the issue is here. This is again the lower right-hand side of the rabbit's mouth. This first cheek tooth in front is normal height, but then the one right behind is just a little bit tall. But then you'll notice there's kind of like a space right back there before you have another tall tooth in the back. So that's a wave mouth. It's down, up, just sort of really wonky and all out of order there. So what do we do when we have malocclusion in the mouth of a rabbit? Well, the treatment of choice is to do a molar trim. So this, again, is just a rabbit that's on a dental rack under anesthesia, and he is having his tongue just kind of pushed off to the side so we can see those teeth a little bit easier, and we're actually going in there to trim things up. Here's a zoomed out picture of what it looks like for a rabbit to be on a dental rack. So the rabbit is under anesthesia. He doesn't know anything that's going on right now. We don't have rabbits on these things when they're awake because there's no way a rabbit would stay on something like that awake. He has, just to kind of orient you guys, this apparatus here, that is the actual rack itself. He is laying on top of it, and his upper incisors are on the upper portion, lower incisors are on the lower portion. He has a little cheek spreader, so it's spreading those cheeks nice and open. He has this little tube going down the center. That tube is actually going into his trachea. That's breathing for him. That's attaching him to the anesthetic unit so that he is able to breathe during the procedure itself. He has some warm water bags on either side of him to keep his temperature up while he's under anesthesia. He actually, this little thing right here, that is a little blood pressure probe so that we can be monitoring his blood pressure during the procedure. And in the back here, that's a little fluid pump in the back. You can't see his IV catheter, but he has an IV catheter in his ear so that he's getting fluids during this whole time. So while he's under anesthesia, he's being monitored very closely, and we're doing a lot of stuff with him to keep him as normal as possible and make it as safe as possible for him to be under anesthesia. But back to that mouth. We have that mouth now nice and wide open so we can actually get in there to do the detailed work that we need to do. So I'm going to show you guys a video. This is a video of Dr. Kanpur doing a molar trim. So what she's doing here, the rabbit is under anesthesia, he's on the dental rack. What she's doing is she actually has a little very fine detailed dental burr that she is using to trim those incisors, or excuse me, those molars. So what she has in her hand right there, that's the actual dental drill itself. And so she's going in there, she's using a little light as well to really get a lot of detail in that mouth, and she's using that drill to actually very gently drill down those molars. But so it's going in there, and that tool is really, really helpful to trim those teeth down very precisely and very accurately, shape them the exact way that you want to shape them. There are other ways to do molar trims in rabbits. Anesthesia is not the only way to do a molar trim. There's also something called a molar snip. And so what this instrument is here, that's called a rongeur. And what it does, it's a little bit more crude, but it helps, you basically can put that into the mouth and snip off those really big points. This is helpful for rabbits that have just like one little dental point that we need to go in for. It doesn't do the as detailed work as that drill does, but it does actually help quite a bit. Now, when we're actually doing a molar snip, molar snips we can do awake. We don't have to put them under anesthesia for that. So what's going on in this picture here is I'm using an instrument to actually look into the mouth of that rabbit. There's a little light source on the end, and there's cheek spreaders on it as well. So I'm stabilizing his head, and then I'm putting that instrument into that mouth to kind of get a visual of what those teeth look like. And then you can see the actual instrument itself right there, and right there from the side, going into the mouth between those little cheek spreaders to reach into the back and actually snip those molars. So then the question is, well, how do we decide if we're going to do an actual anesthetic molar trim versus doing a molar snip? So we choose to do a snip if there are only one or two teeth that are a problem. If the patient is a poor candidate for anesthesia. Not every animal is, safe to undergo anesthesia for whatever reason. Most animals, anesthesia is something that is extremely safe. As you can see with the one picture where we're hooked up to monitors and we're breathing for them, we are having them on IV fluids, they're monitored very closely, but there are certain animals who maybe are a little bit more sensitive, or maybe some elderly animals who have other problems going on that would make anesthesia a higher risk. So in those particular instances, we may not feel comfortable putting an animal under anesthesia, so we may want to do a molar snip for them instead. The other reason that we will often do molar snipping is to get the animal some immediate comfort and immediate relief. Some rabbits that come in that have, horrible dental issues and have these big spikes that are poking into their tongue or poking into the gums and causing them a lot of pain in their mouth, we want to get them feeling better right now, because nobody wants to have a dental problem and have to wait, a week or two to have to actually have it fixed, right? So we don't want our rabbits to go through that either. So we will snip those teeth that are really big and pointy and causing a lot of pain in the mouth. We snip those down and then try to prepare them to actually go to the anesthetic dental, within the next few days or so, and actually have them trimmed down very appropriately, shaped, and, dealt with a little bit more accurately. And that's really what the molar trim under anesthesia, the greatest benefit of it is that it's extremely, extremely precise, and you can do so much more accurate work and detailed work, and work that will actually last quite a bit longer and get more long-term resolution for the rabbit. So, other issues that we deal with in rabbits is cheek tooth infections. Just like those incisor infections, we do see a lot of infections in the cheek teeth of rabbits. They often occur at the roots, so that's below the gum line. And so there are many different types of bacteria that can be causing these particular issues, and you can actually have quite a variety of manifestations of the problem itself. So the signs that you might see: you may have a decreased appetite, you may actually see swelling along the jaw itself, you may actually see pus on the jaw, or you can even see a bulging eye. So I'm going to show you a bunch of pictures of what cheek tooth infections look like. Some of them are a little gross, so I warn you ahead of time. So here's just one little rabbit who has, you can see on the side of his face there, a, wound of some sort. So sometimes people will come in and be like, there's something on the side of his face, I don't know what's going on, but based upon the location of where that is and when I actually feel the rabbit, you can identify that, oh, there's actually an infection there that's breaking through the skin and it's associated with the roots of the teeth. Here's another rabbit who has not had infection break through the skin. This one just has a swelling along the bottom of the jaw. A lot of these cheek tooth infections actually are going on for quite a prolonged period of time before the rabbits start to really show and manifest signs, and there will often be a lot of bony changes to the jaw itself. And so this particular rabbit, we can see a big swelling there, and my suspicion with this particular rabbit is that there's probably some changes to the jaw itself that are going to be permanent long-term changes for him. This one has a cheek tooth infection on the upper portion of the jaw, those upper molars there, and it's just kind of breaking through the skin a little bit. And then this one is another one that we have a real significant swelling on the side of the face that has not broken open yet, but there's a lot of pus accumulating underneath there. We are often lancing outside of the mouth, and the reason being is because if we're lancing inside of the mouth, there's not as much space to be working in there. And a lot of times when we're lancing them, we are leaving them open to drain a little bit too, because there's so much pus that accumulates in there that we want to leave things open so that things will continue to drain out. Sometimes we're closing them, it all depends on the individual. But if we left things open to really be draining into the mouth, which sometimes that happens, then the rabbit's having to deal with pus continually leaking in his mouth. And then the other thing too is we can control the cleanliness on the outside of the face better than we can control the cleanliness inside the mouth, because they're still having to eat and everything. And so if you have, you know, open wounds inside the mouth or pockets and things like that, then when they're eating, they can get food that just gets stuck in there. And, you know, food has bacteria on it. Bacteria is everywhere. And you know, when it would normally pass through and not be a problem, it may pocket into there and be like, oh, this is a great place to live, and then it overgrows, and then you have another infection that happens, or it's one that just doesn't resolve. So, and this little guy, his sign is he was drooling all over himself, and you can see he just is just covered in drool, and he has a little bit of a swelling on the bottom of the jaw there. That guy is really, you know, manifesting his signs that I don't feel very well. You know, my jaw really hurts, and he's just drooling all over himself. Here's a little graphic picture, but this is a rabbit who has a infection in the roots, in the upper roots, kind of far in the back. What the rabbit came in for is it has its eye that's appearing to bulge out of its head. And though it may seem as though it's initially just an eye problem, when we see a bulging eye like that, we know that there's something behind the eye that's making it bulge. And there's actually an MRI picture of this particular rabbit where you can see that there's actually something behind the eye. So this is the good eye, this is the bad eye that's bulging out, and this little area right here, that's a pocket of infection that's originating from a tooth root right there that's causing that eye to bulge out. Okay. So when we're dealing with cheek tooth infections, our treatment is very similar to what it was with the incisors, in that we have to be putting them on antibiotics, cleaning these things up. A lot of these guys that have these really big swellings, they need to have that abscess drained. Just simply putting them on antibiotics isn't going to be enough. Occasionally, I've had a rabbit where miraculously it has been okay, but, you know, 99% of the time, they have to have some sort of opening of that abscess, draining things out in order to actually allow for these things to heal. We are often wanting to culture these ones. The reason being is because we really, really want to know what is it that we are dealing with, what is the organism that's causing the problems, and that way we can put them on the most appropriate antibiotic. Because sure, we can take a guess as to which antibiotic is going to work effectively. There's lots of great antibiotics out there that have a lot of good coverage, but there unfortunately is more and more antibiotic resistance out in the world. And with that, we need to avoid it as best we can so that we're not having our animals really be, you know, dealing with these things for longer than they need to. So, a lot of these guys do have to have the infected tooth removed, because leaving that root in there, sometimes the bacteria are just hiding out right next to that tooth. It's hard for antibiotics sometimes to really clear everything up, and you actually have to get rid of the infected tooth to truly get rid of the problem. A lot of these guys are needing anesthetic dental trims as well. This is a picture of a rabbit that's actually having surgery behind the eye. So this one's a little bit more graphic. I apologize for that. So so what's going on here? This rabbit's under anesthesia. Everything's draped off all surgically, so that's why you're only seeing the eyeball kind of popping up there. And the eyeball is actually really, it's coming out a bit because of the fact that there's pus behind it. What we've done is we've actually made a little surgical cut below the eye, and that white stuff right there, that's pus. And so that's the pus that's actually starting to be drained out of that eye. The lower picture there is a little bit more advanced into the surgery itself, where we've gotten the majority of that pus out of the eye, or out from behind the eye, I should say. So this is just one picture of a rabbit that ended up having jaw surgery on the bottom jaw because it had several infected molars, and it actually had the jaw opened on either side because it had abscesses on both sides, had all the infection basically drained out, had to have some teeth removed, and this is him just before he's waking up. This was an individual where we actually put antibiotic beads instilled into the area, and so this one we actually closed up the surgery site. So, because he has antibiotics that are just sitting in there and allowing for the infection to be dealt with that. Okay, so trauma was another one that I mentioned as a issue with the cheek teeth. The issue with trauma is just that if you have a rabbit that has some sort of trauma at some point to the face where it actually may have had a fractured jaw, then if you have healing abnormally of that jaw, then you may not have those teeth lining up appropriately, and you can have something like a malocclusion occur. So it's something that if we ever do have a rabbit that has had some sort of jaw fracture for whatever reason, then we're always letting the people know that this particular individual rabbit may later on down the road need to have dental trimming for the rest of its life if those teeth don't line up appropriately. So just a few more things to talk about with you guys. So when we are dealing with dental issues, there's often two things that we're really wanting to do as sort of diagnostics to help us a little bit with these problems. And one is x-rays, and the other one is cultures of the infection that's present. So the reason we like to do x-rays is because it helps us to identify which teeth are the problem, so that we know where we're actually going when we're doing our surgeries and corrections of our diseased mouth. And it also helps us to see if there is any sort of bony change that has been occurring to the mandible. So I'm going to show you guys a few x-rays. This is a normal rabbit skull. And just as I was mentioning earlier how the incisors are very long, so these are your upper incisors and your lower incisors. You only really see the incisors to about that level. That's the crown. The root actually goes all the way back there. So when we're doing those incisor extractions, we have to go really, really far back. The lower incisors, you can see that the root goes really quite far back. So this is a normal rabbit skull. As we start to have some issues, this particular rabbit has tall molars and overgrown incisors. So you can see these incisors are starting to curl in, and these molars are really, really, really kind of tall, and it's those molars that are causing this problem. Because as those molars get really, really, really tall, it makes it so those incisors can't come together. And if those incisors can't come together to do normal grinding, then those incisors are going to overgrow. And like I said, the upper incisors tend to really like to sort of make little loops. Here's an issue in a rabbit where it has the roots that are really overgrown. I don't know how well you guys can see it, but the roots are really starting to have some changes down here. This is a up-close picture of a rabbit that has a tooth root abscess. So what you can actually see as the abscess is you can kind of see this area of black kind of around the roots of the tooth. That's actual bony changes to the root and the mandible around the area. And then this rabbit has a very sort of end-stage mouth. He's missing numerous teeth. He's got really elongated molars that are still sitting in his mouth, the ones that are there, and he just has fragments of his incisors. So like he really doesn't have much as far as the lower incisors. You really can't see anything, but like up here, this is a fragment of the upper incisor, it's not even coming through the gum line. So if you looked at this rabbit, you would think, oh, it doesn't have any incisors. But then you take an x-ray and, oh, it actually does. They're just the roots. And then over here, you can see you're missing a ton of teeth on the bottom. And then these molars that are here are just really, really overgrown. And so I already sort of mentioned it about the culture, but I just wanted to bring it up again. There's lots of different types of bacteria that can be associated with infections and issues in the mouth. So if we really want to know what's going on in there, how we're going to treat it most effectively, culturing is really the way to help us out and help to resolve issues a lot sooner than if we were to just make assumptions about what could potentially be there. So the next thing is prevention. How can we prevent these kind of issues from occurring in our rabbits? Now the problem is some of these things, genetics may play a little bit of a role in it, and we may not be able to completely prevent all of these sort of issues. But the way that we can most effectively and most appropriately prevent these problems from occurring is their diet. We want them to have hay as the main portion of their diet. Those silicates in the hay is really what's helping to keep those teeth ground down effectively. When we have rabbits who have molar and premolar problems, cheek tooth problems, that their molars are just always growing really tall, and maybe eating okay hay, then sometimes we're also trying to add other things in that are really hard for them to grind their teeth against. And so things that can be helpful would be the branches or the bark of different types of trees, ones that are okay for rabbits, apple trees, any sort of citrus trees, and then willow bark is another good one. So all of those are healthy and appropriate and not going to cause any sort of toxicity.